Hi, and welcome to another episode of Newsmakers Journal of the Vaccine Year. I'm Jerry Roberts. It is Friday, August 13th, and I'm very pleased to welcome back to our show Dr. Hilda Maldonado, a superintendent of the Santa Barbara Unified School District. Doc, thanks so much for joining us again. I know it's a really busy time for you.
Thank you for having me this morning, Jerry. And I'm still trying to get to used to this doc title.
Now I think it's very befitting. All right, I want to start with a word association question. Don't think about this, just tell me the first thing that pops into your head when I say the words 12,500 nasal swabs.
Impactful.
Impactful, yeah. But that's what's going to be happening, what, on the first day of school? All of the students and all of the staff and all of the teachers are going to be self-administering a COVID test. Is that, if I got that right?
No.
Oh,
Uh,
good.
that's the goal. The goal is correct. The first day of school, no. We're gonna be very methodical and do it in stages. I believe we're starting 2 weeks into the school to do our baseline testing, so it's not going to be the first day. We're going to look at, the team is planning how we're going to do it and how we're going to roll it out. We
And
do have, sorry to interrupt, we do have, of course, we have been collecting our vaccine verification, and I'm very proud of our teachers. Yesterday was their first day back at work, and 89% have been
wow,
given us their verification of vaccines.
89%, that's really high. But just to back up on the swab, so this is a baseline test or set of tests that you want to do for everyone, students, teachers, staff, administrators, and so on. And then will this be a weekly test? Will it, how often will it be administered?
So there's several guidelines that we have around how to do that. There is a set of guidelines that allows us to look at it from different perspectives. And I'm drawing a blank on what they're called. We will do a baseline of everyone, and then from there, depending on what we get in the results, we will decide how to then move next. So it'll be in stages. There may be areas where, let's say, we do find negative in a particular school or a particular classroom. Then we'll go further with the more. The first was our rapid results. The
Yes.
next set of tests will be, antigen tests and so forth. I'm losing my words. You made me nervous with the word association,
I, I,
Gabe,
I apologize,
and
but
I'm blanking out. But the point is that it's not like every week, every Monday, everybody gets tested. We're really gonna just have this campaign about doing our part to keep our kids in school, and we're gonna be methodical, and we're gonna be studying what happens in the system, and then from there make decisions on who will be tested and how often.
yeah. Well, as you know, the Goleta School Board decided not to have the self-administered swab test for the students, at least. One of the board members said, these are little people and they have feelings about their bodies. There's some psychological element to it too. What do you say to that argument?
Well, I find it interesting that they're doing it that way. I don't know what their bent is. I understand the psychological, but I know that we give our kids vaccines when they're little. My two boys have, had vaccines all along. We're taking a different stance in Santa Barbara Unified, and we really want to make sure that if we're going to keep our kids in school, that we know that they're safe. There are parents that have called me and said, I think my son's going to get anxiety, or my daughter. And we have healthcare workers, we have nurses in schools that we're gonna be mindful, and we're not gonna run around just swabbing people against their will. I am very confident that there's so many caring, compassionate people in our school systems that are gonna do this thoughtfully.
And So what happens if a student tests positive? Are they then sent home and everyone they've exposed sent home, or how's that?
Yeah, the guidance has changed a bit. You know, last year it was like you're exposed, you're gone for 14 days, then it became 10 days. Now it's looking at, were they masked, were they not masked, do they have symptoms, do they not have symptoms? So there's all new guidance around that space, and we're going to take them on a case by case basis. But there is a decision tree we have to follow that kind of asks these kinds of questions: masked, no masks, symptoms, how long were they exposed to each other, and so on.
Yeah. And 89% of teachers report themselves vaccinated. That's great. I mean, that's really, uh, and what is your sense about the other 11% that it's because they don't want to be vaccinated or they haven't been vaccinated yet? I mean, do you think we're going to get to 100% on that?
Well, you know, we have people that have underlying health conditions that may or not allow them to get vaccinated. So we're going to look at that. We haven't polled people to find out why they're not vaccinated. We also have a lot of new employees that get counted in that data. So some will be working on to see what they need in terms of support. I don't think we ever get to 100%. That's always an aspirational goal. There's always going to be one or two people maybe that need some support or, again, have underlying health conditions.
Yeah. And then what about the students? Students 12 and over are eligible for the vaccine. What is your sense, or what data do you have about what percentage of the students 12 and over are vaccinated?
We don't have data just yet. We'll start asking that information next week. We did do some springtime vaccinations. We took kids on buses to Cottage Hospital for, if parents allowed us to get vaccines. I'm also working with public health to bring mobile clinics in September to the high schools and to La Cumbre Middle School or junior high school, to offer vaccinations for people that would like to just have that service a little closer to them.
Okay. Is there any thought being given to a vaccine mandate? And I know the school board was ahead of the state in terms of the teachers, the mandate for teachers, a vaccine mandate for students 12 and over.
Well, we haven't really necessarily discussed if we're going to do that for our students just yet. No, not yet. I think I believe strongly that it's something that, you know, my own children have been vaccinated, my nephews, my nieces. I have family members who were not for it, that we had talks, because I come from a large family. We like to get together, and you know, we recommend it highly to our parents. But again, I want to recognize and acknowledge there are people with underlying health conditions that it's not a one size fits all response.
Okay, so no mandate for students. And then what information do you have, or what's your best information on when the vaccine might become available for younger students, for 6 and over? Are you getting any signals from public health about that?
I don't have any signals on when that might happen, not yet.
Okay, all right. And what are the other protocols that are going to go into the start of school, in terms of class sizes or distance or masking? Can you describe those, please?
So yes, so we do have the masking indoors. That is definitely required. Not outdoors so much. We are looking at outdoor spaces that people may be able to use. We're not doing temperature checks anymore like we did before. We don't have the social distancing requirements either, but we are trying to the extent possible, we're trying to keep lower class sizes, and encourage, you know, kids to stay away from each other. We're putting back all our hand washing stations, making sure that we follow, you know, those cleaning protocols are always important for all of us. Good hygiene. Letting parents know to watch their children. If they're not feeling well, don't send them to school. You know, we had these great campaigns about attendance, come to school every day. And now it's more about if you're not feeling well, please don't come and monitor your health. So I think there's just this really big push on being healthy.
Now, they're not required to have the masks when they're outside?
No.
Okay, all right. And will there be, more instruction outside than there has been historically? Is that another part of the plan?
Yeah, we have put up tents at some of our schools. Well, all our schools have spaces with tents. There's a lot of people that have asked, why don't you just have the classrooms outside? And there's teachers that have tried it with more success than others. Sometimes it does get pretty bright out there. I did get to go see a classroom at one of our schools where the white tent and the brightness of the sun was really hard on the eyes. And maybe I'm just getting old, Jerry. I don't know. But, and I wear glasses, so it was difficult to see. So I'm not making an excuse out of that, but I'm just saying that we're going to experiment with different places where kids can sit outside. But we also are very confident that the ventilation in our classrooms is adequate. If you recall, last year we had a project with UCSB professors that came out and taught us how to measure the movement of air in the classrooms. We've put that back in place with fans at windows, doors open, so we can push the air out. We found that all our classrooms have adequate ventilation. Sometimes people feel like adding air purifiers will also help. And some schools have had fundraisers where they have bought some of those, but that's just honestly like another layer of protection. Our ventilation is very adequate here in Santa Barbara for our schools and our classrooms.
All right, and you have had some political pushback on this, political, medical, whatever you want to call it. There were protesters at the outside the meeting the other night. I guess both about the vaccines and about the masks. What sanction is there? In other words, if the kid's parents say no, he or she's not gonna wear a mask, what happens then?
Well, we are offering independent study programs. So we know that parents have different choices for their children when it comes to whether or not they want them to wear a mask, or whether or not they want them vaccinated, or whether or not they require certain accommodations. And I think now that we've had legislation from the state around independent study program as the program of choice, if you don't want to do the in-person schooling, that's what the parents will be offered.
And what is that? Is that the same as the Zoom school was last year, or how is it? How does that manifest?
Not exactly the same, but it's adequate to the grade level of the student. So we've had independent study in our school district for many years through our Alta Vista, La Cuesta programs, where students, mostly it's existed in the high school space, where students work with teachers in the different subjects. They create learning plans, they check in with them, they sometimes come to class here at La Cuesta. There's different models of individualized programs. In the lower grades, we're going to use the learning platforms that were used in the remote learning spaces like Neo, Canvas, and others, where the teacher will post the work for students, will meet with them remotely, check in with them. Depending on the grade level, the frequency will be longer.
So all first graders would be getting the same curriculum and content alternatively via Zoom as a group or individually? I'm just trying to picture it.
Yeah, I know. This is a great question. I love this question because I think people always assume that kids come in these perfect packages of 24 by grade level, but they don't. So it's going to be a mixed grade level situation. The expectation is that it is the same curriculum that you get. It's the delivery of the curriculum that changes. And so depending of the grade level, it will have to be more individualized to the way that the teacher is going to be able to access the student. So you will not see a remote teacher first grade all day long with first graders. That is not going to be the delivery model. But there will be posting of work that they need to do, and they will be calling in students or setting up appointments, working with parents. There will be a contract made between the parents, the teacher, and the student as to how that schedule will work. At the end of the day, the expectation is that everybody gets the same curriculum. It's the mode of delivery that's going to be different.
Boy, this is really complicated stuff that you're dealing with. What do you have a ballpark idea of what percentage of the overall student population is going to be doing alternative Alta Vista alternative school?
Yeah, I believe it's a very small percent. I want to say it's in the 40s for elementary school.
40% or 40
no, no, no,
students?
40 students, not percent, not percent. 40, just around 40 students. And in the junior high, it's about 20%. Sorry, 20 students, not percent, 20 students. So all in all, it's about 60 students out of our 12,000 student population.
And then in high school, you would have alternative students anyway, right?
We would already have those
in
students.
the normal course of business.
That's
Okay.
right.
All right. Okay. The other thing is, as you know, for whatever reason, this Delta variant is really striking a lot of kids, a lot of young people, and there've been exponential rises among unvaccinated pediatric hospitalizations as well as cases. What are you thinking in terms of scenarios or worst case or so on and so forth? You got more than 10,000 students, probably more than half unvaccinated. What is this going to look like, and how committed are you to keeping the schools open?
Well, we are 150% committed to keeping our kids in school and keeping our schools open. That is our main mission, because that is why we exist. As far as what we have done is basically, I have to say, Jerry, I have an extremely capable cabinet, along with principals, and they have been working out scenarios. What if it's 10 kids in a classroom in elementary versus junior high versus high school? What will that look like? What if it's the teacher? What if it's the whole class? And so we're now working on models of responses that we will have in place depending on these. I think we met yesterday, they started off with 10 different scenarios, and then we just kind of worked through it, and we realized, there's only about 2 or 3 different ways that we can really respond and think about this problem or these problems that may arise. At the end of the day, I think we know how to pivot, we know how to adapt, and we know how to communicate with our families well. So depending on if any outbreaks happen in that way, we're already putting in place how that will look. The technology has really changed how we think about education and how we can do things. But I'll be very honest. Yesterday, we welcomed all 800 teachers back to their first day of professional learning. I Zoomed from Santa Barbara High School. We had all teachers at each of their school sites with their principals, and we delivered our professional learning through Zoom. I think I got kicked out 6 times as I was trying to deliver my remarks. So it's just the truth. It's just honestly, while we know technology really works, the internet is not going to always cooperate. And it makes it difficult to learn. It makes it, so that we don't have this very good, clear exchange of communication. And so we're looking at all those ways that we can respond. I really believe that we have learned how to be more agile and more flexible, and we'll be doing that as these things happen.
But you're really going into the year with these scenarios in mind, because, as last year showed, who knows what's going to happen. It's a pandemic. It's unpredictable. That's one of the things about it. And so I just want to underscore that point. You say you're 150% committed to keeping the schools open.
Yes. But we're not going in blind. We have contingency plans in place.
Okay.
We used a I don't know if you've heard of the Stockdale Paradox. We used it a lot in our work last year. This idea that we have to be extremely optimistic while being extremely realistic, and balancing this paradox that happens when we have a demand on us that requires us to be flexible, but not losing sight that there's hope at the end of the tunnel. And so I don't know why you caught me so off guard. I was prepared to talk about something.
I'm sorry.
I'm gonna phone a friend. I'm gonna ask Sean the name of the general that it's from the book Good to Great. If you are familiar with the book Good to
Are
Great.
you talking about Admiral Stockdale?
Admiral Stockdale. And if you read about his work when he was in prison, he talked about this idea that those that remained very positive and were saying, like, we're going to be out of here by Christmas, and it didn't happen at Christmas, they lost hope so soon. They ended up dying at a faster rate than those that were like, we're going to get out of Christmas. Okay, it's February. Okay, we're going to hang in there. We're going to keep hanging in there. And so I think that that's something that we sort of use amongst leaders. We sort of talked a lot about to keep us really moving forward, because we are in a pandemic. It is completely unpredictable, but it doesn't mean we can't plan for it.
Of course, just a tangent here, Admiral Stockdale famously was the vice presidential candidate for Ross Perot, as you remember, well, you were probably too young, in 1992. And he showed up for the first debate, and his opening statement was, "Why am I here?" So don't worry about a thing if that's, that's your guidance.
Thank you for that grounding, Jerry.
Hey, let me, when we talked about the schools staying open and, having to be closed last year, and a lot of controversy about that. And of course, the big concern was learning loss among the students. Do you have any data yet that would kind of define or frame what that problem is from last year going forward? How much learning loss has there been?
Yeah, I don't have a measurement to give you in terms of numbers. I know that our summer school measurements that we did see some of that loss, particularly in elementary, where we did look at reading. It's an area that focused for us. We just had this day of learning yesterday with teachers, and we are fully committed to improving language literacy and mathematics pre-K-12. We had a long conversation with our teachers about our emergent multilingual students that have been largely underserved in our school district. And we know that if we create more literate people in the elementary grades, by the time they get to junior high and high school, we won't have to be remedying that situation and investing a lot in intervention. But we're actually going to move a lot of our funding down to our elementary school to do some prevention work in that space. We know that there, particularly, just imagine being a preschool, TK, K, first, second grade student, learning to read in remote learning, is a challenge. And it's a challenge in person, so I could only imagine how much more it was online. And so that'll be something we're just going to assume we need to focus on and do a lot of good work in that area.
So would it be fair to say that, based on what you know now, that the impact of the closing of schools and the pandemic overall, kind of the differential of the way that COVID affected different ethnic groups, that it's probably making the so-called achievement gap or learning gap or achievement debt, whatever you call it, it's making it worse, or it has made it worse. Is that your assumption?
Yeah, but the thing is that we work with people and individuals, and so there is some kids that have done really well too. So while there is some that have suffered, and there still exist achievement gaps until our systems really change and really do things differently, which we are investing a lot in. I'll tell you more about that in a minute, but there were kids who actually did better in the remote learning as well. And I don't want to overlook those kids. I think largely we also don't always talk about the social emotional impacts of that lack of connection to peer groups. So maybe for Latino students, for argument's sake, our academics need to improve, but for others, it's the social emotional supports. And so everybody has something that needs worked on. And what we have done this year is we're investing a lot of our federal funding in what we're going to call multi-tiered of support system administrators and teachers on special assignment. Those group of people, I'm calling them my guardians of student outcomes. What they're going to be doing is looking at students from all aspects of their achievement, not just academics, their sense of belonging, their sense of connection to school, their mental health wellness, so that we're really honing in on what is happening with students and what is causing that impact to learning. We know that the conditions of our classrooms, of our homes, of our community impact how we respond to learning. And so we're gonna really be measuring that throughout the year, not just at the end of the year. We also invested some money in our data information systems so that we can have more at the ready data. We created data information sheets for teachers so that they can see exactly where their kids need support. We showed those to teachers yesterday so that they can really track achievement in a more on-time basis rather than at the end of the school year. So there's a lot of systemic changes that we're making in spite, like we're not going to just try to study the problem. We're going to just attack it from the get-go.
Yeah, see what works. Okay, and real quick, have you had to hire additional teachers or support personnel to carry out all of these complicated things that we've been talking about?
Yes, we are, we have, and we still have openings. So if anybody watches your show and needs a job, there are many jobs in Santa Barbara Unified at all levels of our system, from teaching assistants, fiscal services, food services, facilities, after school care. We're looking for folks to help out in that space too. We've had some people move out of Santa Barbara. We've had retirements. So yes, we do have a lot of openings, and we have lost teachers to other school districts too. That's just been something that's a reality, I think, for all of us who got a lot of extra funding from the state and federal government.
Yeah, and what's the situation with that funding? Is it all from the feds, through the state? Have you also, I was told you've also received some private funding, or at least one major gift. Can you talk about that a little bit?
I don't know about a major gift, but we did get 36 million from the federal government for the next 3 years.
Okay, all right.
Yeah.
I thought there was a substantial donation to the cause of internet access.
Oh, that was last year. We got $100,000, and we raised, substantial amount of money through the Santa Barbara Ed Foundation, which was very helpful for families who needed help with internet bills. So we were able to help about 2,000 families with their internet bills through that donation.
And have other donors come forward to kind of support that vision at all?
Yes, other donors came forward through that campaign that was led by Santa Barbara Ed Foundation. We're also getting some funding in the literacy area. So there's money coming in to support our work around literacy development, both to develop teacher skills, especially, like I was saying, we have a significant number of kids who don't speak English as a first language who need to learn to read in English. And so that's a lot of the work we'll be doing in elementary. So we got some funding. I don't have the number off the top of my head. I'll have to ask Margie Yavi. But we are raising funding for a literacy project. I'm also working with a couple of people on a whole child health initiative to raise money to be able to, now that we have the kids in person, to do eye, ear, and dental checkups, but also get them glasses if they need hearing aids, if they need dental care. So we're hoping to launch, if we raise enough money, launch some of that in October. We're trying to organize that space there's so many nonprofits here that do that work. And that's something that we're going to be raising money for as well.
All right. Well, I mean, it's just extraordinary the challenge that you're facing. I mean, coming in, if there had been no pandemic, you have this huge, achievement gap with a diverse student population issue that you're trying to attack, and then overlay all of this other stuff, and try to wash the windows with your third hand, in the meantime. It's really extraordinary. So, Hilda Maldonado, thank you so much for taking the time at this very busy time, and we'll look forward to all of the news coverage of what happens from the fallout from the mask and the vaccines and the protesters and the Delta variant. And I'm sure that your scenario planning will be adequate to the task. Thank you.
Thank you. We're ready. We're focused. Our mission is children in schools and keeping everyone safe. Thank you,
All right.
Jerry.
Thank you so much.